So the fourth policy we'll be talking about is the additional doctors and nurses in hospitals and ICUs. Where the rapid growth of the pandemic has led to an increase in pressure upon decision making of the government on when and how to spend resources. In order to analyze this fourth policy correctly, we're going to be looking at a positive and at a normative analysis. When it comes to the positive analyses, we need to look at the economic consequences that this policy has had. It's been imminent to increase the number of doctors and nurses in hospitals in order to manage the increase of the pandemic. However, this has had an enormous economic consequence, as it has increased government expenditure, decreasing public savings. This decrease of public savings means that as a nation, we have less economic resources. However, there are some winners with these policies, and that is all the medical staffs and hospitals, as there has been an enormous decrease upon pressure on the work, meaning they can be more productive and effective. When it comes to government interventions, in this specific situation, it is a correct thing to do. Organism capable of doing so. When it comes to the normative normative analysis, we should analyze the trade-off of this cost. As I've said earlier, we've had an enormous increase in the cost of public medical expenditure in our country. However, we have a massive trade-off, which is the nation's health, by decreasing an enormous amount in the number of deaths that we could have possibly had, as well of an increase in the medical resources of a country, which in the long term should help population growth healthier, and therefore mean we have a stronger and more productive nation.
The next policy that should be highlighted is closing bars and restaurants. Devastated by the loss of customers during the virus crisis, around 40,000 bars, hotels, and restaurants in Spain have permanently closed. Without a doubt, COVID has caused havoc and for some irreparable consequences in their businesses that will keep on going if solutions are not imposed. For a better understanding, let's have a look at the graph, in which we can observe a dramatically drop during 2020. In the case of the food service sector, a shock to this sector alone would lower the total employment by about 6,163,550 jobs. Therefore, in order to offset the effects, intervention is much needed. What's more, paternalism is very closely linked. The government should intervene, for instance, by implementing a takeaway delivery service. A lack of competition will arise, and inefficiency will do so, increasing unemployment rate as well as making leisure in our country somehow disappear.
If a full lockdown is implemented, there would be a clear slowdown of infected people, but the economic cost would be prejudicial for everyone, even more than the first global lockdown. As people can't go out, consumption would decrease substantially, which would lead to the closure of many firms, increasing the lack of competition. The bankruptcy of firms would mean that a wide number of people would get fired, and as they will need help, the government should increase the unemployment insurance rate. This is a paternalist normative approach to economic policy. There would also take place a huge decline on the capital market prices and a recession in research and development.
An educational crisis will be generated due to the closure of schools because of the COVID-19 pandemic. A benefit of total closure of schools will be the less spread of the virus. Since contact between children is almost zero, the COVID-19 is not transmitted between them in the same way as if they stayed in school. But there are many costs of school closure. For example, learning, mental health, and social emotional development. Although online education will be implemented, children's learning is going to be partial and uneven. In addition, the development of children in social and emotional terms is going to be much lower than the other children, who have not had to be educated from home. Other cost is childcare, as parents of children who cannot be left home alone have to find an alternative to school. This has a cost at the labor level for parents. Also, and last but not least, the closure of schools makes teachers think of ways for children to recover lost learning in less time, which can affect the children's learning.